healthcare problem in the United States has and continues to deepen amidst a changing political and economic platform. The issues that America will overcome are not simply cosmetic scratches, such as the 50 million without insurance. It is the internal structure and foundation of the entire system that threatens collapse. It is estimated that Social Security and Medicare will run a $53 to $58 trillion deficit in 2019, with Medicare holding the vast majority of that debt. That means each American household would owe over $450,000, which clearly is a number that very few could afford to pay off. This issue is one of the largest that America has ever had to face, both due to the sheer magnitude of the situation and the fact that it is unlike anything else in our country's history. In any crisis of such magnitude, there are multiple problems and issues. These include private insurance failure, inefficient and overcharging healthcare providers, premium medicine, and the growing number of uninsured. Today, many politicians and interest groups are suggesting universal coverage systems as the solution to all of our healthcare woes. And on the surface, it seems like a good idea. However, the reality of the situation in the United States is that a single-payer universal healthcare system will be too hard to implement. Moreover, it's incredibly unlikely that any government agency who would assume control of the plan will be able to eliminate the same inefficiencies that are plaguing our current Medicare system. An ideal healthcare system would include unfettered access, insulation from financial burdens, and affordability so that the system would not absorb excessive amounts of resources. Our current arrangement compromises all three of these characteristics. Any healthcare system must reflect a compromise of preferences. We simply cannot sustain a healthcare system that is both accessible and affordable while insulating consumers from the costs. In addition to the large overlying problems, there are also microcosms for which our current system has no solution. For instance, my best friend's sister was born with a brain tumor. She has to go in for expensive operations every so often to relieve the pressure inside of her head. What is she going to do on her 25th birthday when her parents' insurance no longer covers her? She has a pre-existing condition. No current companies would ever insure her. This is a major issue which must be fixed. At any rate, it's obvious that these are problems to which solutions cannot be made for overnight, and in the end, the basic fact that America needs to understand is that there is no such thing as a perfect healthcare system. There is hope that the future changes in our system will lead to better healthcare for everyone at an affordable price. Only time will tell as to whether the consumer-driven healthcare or universal, single-payer health plans will be our answer. In order to do this, it is necessary that both political parties agree there is a problem and that they begin discussing solutions. It is truly in the best interest of all Americans that they do so.